Hi, my name is Atiqa and I'm from Group 23. Today I will show a sample of a respiratory care plan. So a respiratory care plan is a personalized written description that includes the type and amount of care a patient will receive. And a typical respiratory care plan includes the following, as seen here. Goals of therapy, frequency of therapy, the duration of therapy, medications used, the devices needed, and the methods and procedures. So here is a sample of the respiratory care plan that my group did for our assignment. Firstly, we tried inserting a nasopharyngeal airway, and the device we used was a nasopharyngeal airway, and the goal of this therapy is to provide an opening that air can flow through. We did this therapy for about 2 to 3 minutes, and we tried one time, and there were no medications used. Next, we also tried inserting an oropharyngeal airway, and we used an oropharyngeal airway to do so, and this helps in stopping the tongue from falling back into the patient's throat, so it makes them to breathe easier. And the duration of the therapy was around 2 to 3 minutes, and we did this practical task twice, and there were no medications used. The third activity was we tried to use a pulse oximeter, and yes, of course, we used a device which is a pulse oximeter. And this therapy or practical work is for measuring the saturation of oxygen in a person's blood, and the duration of this therapy is quite short. It's around 1 minute. It's easy, and we did 8 times, and there were no medications used. And lastly, we tried checking capillary refill, and there were no devices required, as it's just pressing the tip of the fingers. And this practical task is for assessing peripheral perfusion in people at risk for shock. And since this task is quite simple, it only requires around 1 minute, and we did this task 4 times, and there were no medications used.